Thank you. It is not every day that one gets to have a former union minister and a former mayor together on the same stage talking about health. A former mayor of a city that's also now a state. And so therefore, I will ask you to scale a little bit, not just think in terms of the city alone, but in terms of a state. And sir, for you, not only from your previous experience as a union minister looking at the Union of India, at which point in time it was closer to 1 billion people, to also think in terms of the unit called a constituency, a parliamentary constituency, which has how many people for you now?
It's about 15 lakhs.
About 1.5 million people, right? So we have scales here and we have wide experience, vast, varying experiences. One of the first things, would either of you stand for election on a health issue, and would you lose on account of a health issue?
Yes, currently so.
Currently so. You would stand for it?
See, the problem in India is there's not much of investment in it. And the government is not taking health seriously. The highest cause of rural indebtedness in India is health, spending on healthcare. Not on agriculture, not on food, housing, education. It's just pure healthcare. And I don't see them doing much.
And so therefore you see it as a valid political platform to stand on?
Absolutely. My constituency is a rural constituency. And rural indebtedness in healthcare is scarce.
Does that scale to an urban setting like Delhi?
See, health definitely is a very, very essential. Health definitely is a very essential, and health for all. I think it's right for every human being, and there are many, many, many challenges. And we need to work on that. We are working, the government is very serious, but huge challenge. There are many, I can talk about many, many initiatives which government is taking, but still the budget which has been allocated is not at par, like where we should be. Like it is being very, very truthful and concerned about the health issue. I've been the health chairman also before the mayor. We have chairmen, so dealt in primary health. So I feel this is one big challenge in front of India where a lot need to be achieved at the central level, at the state level, at the town and villages level.
So you were health minister when the national health policy was rewritten out. At that point in time, the ambition was that we would increase our share of expenditure on health or investment on health from whatever it was, below 1% to 2.5%.
0.9%, 2%.
We still haven't gone anywhere. And 15 years later, ma'am, you still say the same thing, that we haven't spent enough. So what happened? Why haven't we...
See, the problem in India is, we spend 6% of our GDP on health. But the problem here is, out of 6%, 0.8% is from the government sector.
The rest is coming out of pocket?
Out of pocket. 5.2% of expenditures from out of pocket. In France, it's about 11.6%, out of which nearly 90% is from the government sector. In Germany, it's about 11.5% of the GDP is on health, and 88% from the government. So here, the US, it's about 17.9%, but they're mostly in the private sector. But the problem again here in India is the facilities. You have 70% of facilities in the private sector and only about 30% in the public sector. So that is where the investment part is, it's most important. When I took over as a minister, it was 0.9%. When I relinquished, it was 1.2%. Today it is 0.8%.
The economy has grown too. So total dollars may have.
GDP is growing, but then the investment needs to grow.
Right. So what has prevented this growth? Or what can be done today?
See, India is a developing nation, and we are developing very fast. And at the same time, the challenges of the national security and the defense. So the budget, you know, the reality is the amount of budget which government wants to allocate to the health sector has not been able to do it as much as they would wish to. Or, you know, that the plan, the action plans are there, the health policy is the vision is there, but then of course a huge amount of money is required, because India, the one very big challenge is the population also. And looking at each and everything, one feels this is definitely a challenge, but sincerity of the government and you see the total vision of the government is in the right direction. And now we have allocated a big good amount in the defense. And I feel in the next year one would see a big jump in the health sector also. We have achieved it in the agriculture also.
So I would say...
So it's not that one is not focused on health. Health is definitely one big issue, and the private partners of our countries are doing very well. I was told Dr. Satyendra Jain is going to be here, you know, probably
he wasn't here.
Okay. So I just wanted to ask him one thing, that please, for God's sake, don't close any hospital. Try to have more stringent laws, because it's a state subject, and your administration should be more powerful. At the same time, we can't close it. You know, the Delhi people need it at every level. We need small clinics, we need, government is doing,
sure.
We are opening 6 more AIMS who have been recently given green signal in 2017 at Jharkhand and in Gujarat. So we are going towards that, but still a lot has to be achieved.
A lot has to be done.
Yes.
Agreed. I mean, we are called to innovate in every space. We are told to become more effective and efficient with lesser resources. I mean, I should maybe push back and say, maybe we can apply the same mantras also in our defense and in other spaces also, and prioritize the health needs of the country. Because we have heard from the highest levels, from the Prime Minister down, that we've got a demographic dividend.
If you don't invest in health, you won't have anybody to invest.
Exactly.
Or you won't have anybody to defend.
Absolutely the greatest
So
point.
you invest in defense, but then you won't have anybody to defend them. This is going to be, see, another issue is good healthcare is not just building fancy hospitals.
Right.
A good healthcare is preventing people from going to these hospitals.
Correct.
By providing clean water, good environment, cleanliness, hygiene, sanitation.
Right. And
yes, of course. Lancet said that 2.5 million people in India die every year due to pollution.
Right.
And out of that, 1/4 of the deaths are due to cardio.
Right.
Ischemic heart disease, cardiovascular factors. And Delhi, you people are most affected.
And yet we go on to design smart cities which have got very limited mobility options for people, which are, to my mind, perversely enhancing the NCD burden in those cities instead of preventing them. So what's so smart about the cities that we are calling smart?
Well, you see, all this, if we talk about the pollution level in Delhi, the environment, you know, one cannot just put it on one government. We all are party to it.
Right.
You know, every stakeholder in Delhi or in NCR, we all are party to it.
Right, ma'am.
Delhi alone generates more than 11,000 metric ton of garbage. We have a huge challenge to manage that, to convert that. You know, it's very easy to say to do it into wealth, but at the same time, I know I can speak and I can go in lengths, but then it's a big challenge. We don't have a land to convert that into rectified tiles and other things, you know, which we would like to put. the technology is there, but at the same time, you know, the space and the state issues and other things comes.
And pollution not only in Delhi, all over
Pollution
the
is
country, all over the
is a
country.
big- yes.
Let's kind of take a quick
Water
switch.
is again a challenge, of course.
Yeah.
The whole thing boils down to the population as well as the civic sense. Now, our Honorable Prime Minister, he's in the whole ministry, and people at large, overall the media, you know, they're getting so conscious. It's not that they were not conscious, but his you see, message is going till down as far as Swachh India is concerned. So one is working towards that, but it's not that one can just achieve it like that.
Sure. You said about civic consciousness, it kind of draws me back to another thought process, which is health is not merely about the delivery of services. There's that too, and the absence of it is going to be problematic. But there's also the uptake part of it, which we call as the behavior part of it, which people are kind of changing to be able to acquire services or seek services for themselves. Back in the day when you were minister, we were in the throes of an HIV epidemic, and people were kind of talking about where's HIV going to go. And I think you were the minister at that point in time when these condom ads were just about being put out there in the radio waves and televisions. And yesterday or day before yesterday, I see on the front pages that those ads are no longer going to be available during a particular point in time. I mean, what are we singling out in terms of behavior? Given, let me put two data points here. We're talking about roughly 48 million pregnancies, roughly 27 million live births. So between them about 21 million losses and abortions. What messages are we talking about in terms of behavior change when we pull out ads like that?
Absolutely. See, India is a huge country with its diversity. We have about 20 official languages. We have 250 dialects, 3,000 sub-dialects. To take a message, to percolate it down, it's going to take it's a huge task. And for example, when you say condoms, when I took over the earlier government, they had a policy of ABC, abstinence, second is being faithful, and then comes the condoms. I said, go for CCC, condoms, condoms, condoms. I mean, here we produce 1.3 billion people. I mean,
that's not happening out of thin air. That's not happening out of thin air.
Yes. I mean, they do sex, they don't talk about sex. And when I said that let's have sex education in schools, they all hell broke loose. I said, what? Sex education? And then I changed to health education. I mean, we do these things, we don't want to hear them, but we keep doing these things. So we need some of things, there needs to be some controversy coming out of it. That's why people talk. The positive type of controversy. And that's why when I took over as the minister in 2004, there were 5.4 million people affected. When I relinquished in 2009, it came down to 2.4 million. Why? Because of all these things which we could take to the people and antiretroviral treatment. So all these things.
I point that out particularly not because of you want to be provocative, but it's 5 years since Nirbhaya happened, right? This is one of those modes where men are to be engaged in. And if we don't have that conversation, we have both an issue with disease transmission or population regulation.
Yes.
And we also have a behavior aspect which is detrimental to the health and well-being of women and girls. And so therefore, in taking off something, are we compounding an issue that otherwise would have had some time to work through into the community?
See, as far as my personal views are concerned, it goes absolutely. I feel it's very important that education is so important. And I strongly feel that youngsters, they do need more education. We have 65% of youth in India. And I fully agree with him. And so my party's view and my view, absolutely different. And I have no...
Thank you very much, ma'am, for being as candid as you are.
I feel the youngsters need to be told, and they should be told in a very clear.
And there needs to be behavioral changes
also
coming out through all these campaigns. And go down to the problem and assess it.
Yes.
Because one of the issues is that we are talking about demographic dividend, we are talking about the largest young population, youth population. This is not going to go away.
Absolutely.
And so therefore, if we have to signal out certain behaviors, whether it is sexual behavior, whether it's gender-based violence, whether it's alcoholism and drug abuse, whether it's mental health and pornography, or whether it is looking at better eating habits, all of them need to be signaled out. They are all outside of the healthcare system. They are in the community spaces. How as mayors and leaders and public representatives
Now you see, of course, there were a lot of voices within my party, and they didn't like it. But at the same time, we have to work in the all sort of mindset, and we have to take out what we would like to do. So the information broadcasting and sort of stuff, some kind of a mindset, because you see certain ads which I see, they are very provocative.
Yes, they are.
They are very, you know, you can't watch it with the family. You know, so it's so we have to educate them who are doing it. You know, there has to be education, not provocation. So we have to ban those, but not these.
Right.
So education has to be there.
See, the problem with the lawmakers today is they think that healthcare is medical care.
The conflation of healthcare and medical care is what is fixed in people's minds.
Yeah, that's hospitals, medical care, that's what it is. When you say good healthcare, the planners need to be not only medical specialists, you need economists, you need town planners, urban town planners, environmentalists, all encompass, and then you need to plan out your healthcare. That is what is needed today. But unfortunately, that's not happening, and they don't understand that's the holistic part of healthcare. So that is something where we're going off track on that. And second is, of course, investment on healthcare.
And I'm glad that we have two public representatives here who seem to have the appreciation of the holistic nature of investments that are required and interventions that are required to achieve health. That it's not merely doctors, nurses, hospitals and instruments and tests, but it's far, far more beyond. Ma'am, you've kind of led our, you've kept our flag high at the Mayors Conference in the UN. Now it's transformed itself to the C40 initiative. You have kind of led us into the global arenas with the Global Fund, where we were kind of talking about how do we do innovative financing to do HIV, TB, malaria. I hope that between the two of you and more people like you, we'll be able to get what you started, what the question that I started off with, people who are willing to stake their elections and their electoral fortunes on the health of their people and not on other issues. Thank you very much for the time.
Before going, I'd like to say that India has had success stories as well.
Yes.
We have succeeded. Like in 2005, we started the National Rural Health Mission. Today, the National Health Mission is a continuation of the National Rural Health Mission.
Absolutely.
And 2005 to 2015, in 10 years, India's maternal mortality has come down by 50%. India's infant mortality has come down by 55%. It's a huge achievement, but not acknowledged, not recognized.
No, UN has prepared a paper and it has been recognized also.
And India is polio free today. That's a huge achievement.
Yes.
India, the tobacco incidence has come down. Unfortunately, the alcohol incidence is going up. The second biggest killer in India after pollution is alcohol. 18 lakh people die due to alcohol in India every year, directly and indirectly. 10 lakh people die due to tobacco every year in India, directly and indirectly. And that's why we need to address the youngsters. India's highest road traffic accidents in the world. And what are we doing for that? So all these things, there's a question mark, and the government has to seriously address all these issues.
In fact, thank you very much for restating that, because the first, second and the third sessions, we actually had time to even pick up each of those questions. And so therefore, we didn't kind of want to pick that up again with you with very limited time. Thank you very much, both of you, for being with us. I hope that many people will both be inspired by your personal commitment to health and in the ways in which you are kind of willing to look beyond the narrow lines of communications and ideologies to say health is a larger thing that we need to work together on. Thank you very much.
Thank you very much.
Thanks, Steve.
Thank you so much. May I please request Kamal Narayan, founder of India Health and Wellness Summit, please come up and present mementos to our panelists. And also Mr. Sharma to please come up and present mementos to our panelists.
This absorbs the pollution, air pollution.